Hi, Dr. Arnie here. I'd like to talk to you today just a little bit about vitamin D. Uh, Interesting. We always thought, well, hey, get out in the sun once in a while and get plenty of vitamin D, and that shouldn't be a problem. I never thought I would have a problem with vitamin D. I hike a lot. I take my dog for long walks. I've been a runner most of my adult life, and I ride a motorcycle. I mean, I'm always out and about, and I hate to admit this, but I don't generally wear sunscreen. But I don't stay out that long. I just stay out long enough to, have a good time, and and I'll get my vitamin D. Well, I was doing some routine lab tests on myself recently, and it was actually probably about a year and a half ago, and my vitamin D was low. And I was like, wow, I got to correct this. So I obviously started myself on some vitamin D supplements. So why would your vitamin D be low? Well, there's a number of reasons. First of all, turns out as we get older, we don't metabolize vitamin D as well as we used to. So it can be low. So we need to take supplements. Vitamin D is very, very important vitamin. They have implicated it. In fact, people with COVID, they've implicated vitamin D in COVID people. Is a great percentage of them have low vitamin D's because it affects your immune system. Vitamin D is important in fighting bacteria and viral infections. Vitamin D is very important for your bones and your dental health. Prevents osteoporosis, which is a softening of the bones and a demineralization of the bones. It helps control how you absorb calcium and phosphorus and the balance of that for bone growth. And so vitamin D is a very important vitamin, and the reason I even want to talk to you about that is because I do tests on many patients, and I am amazed. I would say that at least 60% of the patients that I test in my clinic have low vitamin D's, and there's no real symptoms of it, but it obviously can affect you if you're getting viruses all the time, if you're getting colds all the time, and obviously the COVID-19 is just an example of what can happen if your vitamin D is low. And so I recommend most people that if their vitamin D is I test them first, and if their vitamin D is low, I advise them to get on a vitamin D supplement. Usually about 5,000 units per day. And I've been taking that since I found out my vitamin D was low, and I've tested it again since, and that has corrected the problem. And so if you have any questions on any of these metabolic things that can happen in your body and you want to get tested, please feel free to call us at Delmar Functional Medicine. We'll give you free consults, talk about our program. The number is 858-925-8233. Great talking to you, and get out in the sun, but make sure your vitamin D levels are okay.